Yeah, working with Aboriginal psychotherapy philosophy and foundation, it has a huge impact on complex trauma and the treatment of complex trauma. You're coming from a whole different place where everything is connected and interconnected, and through the generations, and you're working from a place where the trauma is something that is an experience that happened to you. It's not who you are, and you are connected through the generations. You're not alone. You're looking at attachment orders rather than attachment disorders. You're looking at the ways that we're connected rather than the ways we're disconnected. So the eyes you're viewing the trauma from is so different. It's a very holistic and a much wider view of the person's experience. So the client before you isn't just the client, it's the client through the generations, and it's all that is connected and interconnected with that client. So the trauma eyes that you as the therapist you're viewing the trauma from a very different perspective. Let me see if I can give you an example of that. Let's talk about white knuckles for a minute. So white knuckles is a person who comes in from the north and works in northern communities, and he comes in with acute distress, with severe neck pain, agony in his back, and a huge level of fatigue and anxiety. He is afraid he's dying, or something is haunting him, and something is haunting him. Now, from an Indigenous perspective, or looking at that from with Indigenous philosophy, all of those symptoms, the neck pain, the back pain, the distress that he's under, and the nightmares he's having, all of that fallout is not necessarily trauma that belongs to him, because you're in an interconnected perspective. So you're more curious. It's a wider thing. What is that? Is that all him, or is that something coming through him? And so the therapy questions become quite different. It's a more holistic look. It's not an I, me, my feelings. It's there are these feelings there. There are these symptoms there. And how do they relate to the holisticness of that individual's life? And so in the case with white knuckles, we'll call him, the symptoms in his neck, his back, they all seem to be, when you see him there in all that agony, it seems like there's an adult there. So it's not like he's regressed, like, little boy type stuff. It's not like a flashback. It's not from another time. It's like he's a man feeling this. So this is an adult felt sense. And that adult felt sense seems to be coming from today's world. And so the questions there are, what's been going on in your life recently, where this is coming up. And it just so happened that he had been dealing with clustered suicides, which is something that we have to face, daily in the Aboriginal communities. So he was the person who was first on site for the hanging boy, and the hanging boy was part of a series of children that died in a clustered suicide. So, like a copycat suicide. If you don't know what clustered suicide is, it's a series of people dying together. So when we check into his body, that's why body-centered psychotherapy is so important. And when he checked into that, he could sense that it was as if it was his throat, as if he was hanging, as if, and so he was carrying all the symptoms of the person that had died recently. And so, again, without reducing it, we could then go further into it. We could then go into, okay, so there you are. You know this is this boy's experience, and you're holding this boy's experience. Where is the boy? So that we can connect with the boy. So again, the idea is that you're working with all dimensions, and time, past, present, and future in the Indigenous world is all now. It's dimensions and layered and available, so we can go backwards and forwards in time and connect to where we need to connect. In this case with White Knuckles, he needed to connect with the boy, the hanging boy, who was somehow stuck between worlds. And once we got there, he then could connect with actually the whole cluster of kids that died, and to see what it was that was in their way that they were haunting him for. And without giving, the whole story all the time, just to let you know there, it was that these boys were kind of stuck, and they needed some assistance to pass over. And so that call that came to him through the symptoms of his body, that felt sense, that anxiety and agony that he was feeling, was actually more to do with the kids that died. It was their feelings and their problem that they needed some help from him in. And him being the healer and helper, he was able to do that. And the children were then able to die and pass over into the family of ancestors that could help them along in their journey. So it's a very different approach. When someone has symptoms that are where there is regression, and where there is a childlike call within the person sitting there in their symptoms, whether you're tracking rage or depression, or you're tracking whatever the despair or agony is that the person is presenting in an interconnected way, from an Indigenous philosophy, from an Indigenous psychotherapeutic perspective, you would not necessarily consider that as necessarily being all theirs. In fact, it may be, the situational felt sense, or the energy at the time where whatever was going down. So you would go to where it went down and unravel it from there. I think the other thing that's so remarkable about Aboriginal psychotherapy, and so wonderful, is, that sense that you really aren't alone. That if your loved ones weren't able to be there for you, your parents, your caregivers, they aren't the whole picture. There's much more there for you. You don't die without that. You have a whole series of attachments that are available to you and were available to you. And so in Aboriginal psychotherapy, there's kind of an acceptance that, okay, and there has to be an acceptance, because we're coming out of genocidal policies where 42% of the children were dead, and people are coming out of horrendous experiences in residential schools, and the option of having the luxury that your parents loved you or were able to love you and give to you, it's not there all the time. We accept that sometimes in the Aboriginal world, given what the atrocities we're moving out of, that we didn't all get what we needed, and certainly not what we wanted, and it was hard. It's been a difficult struggle to survive, and not all of us have survived, and many of us died, and those that have that are living, struggle with living. It's not always that easy, but there's this knowing that the land is there for you, and that that you are everything that is around you. Everything is animate, and so everything's available. So you do have the rocks and the trees and the water and the animals. You have life there that's there to support you and to hold you through these troubling times. So you're not ever really alone in the ways that the Western world perceives aloneness. So it's very helpful, because when you reach those terribly lonely places, you can connect into the earth, and you can connect into all those things that are connected and to you and with you, so that you actually do have what you need. Maybe not what you wanted, but you have a lot of what you need, which makes healing, when that is missing, it's very frustrating. And I think another part of when that's missing in therapy, it's very frustrating. People take years recovering from loneliness and from the agony of isolation, because what's missing in the psychotherapy is the indigenous philosophies that really are there to support you through. We're designed to handle just the most horrific experiences when we're all interconnected, but to go it alone is really difficult. So to open up to your connections and attachments are remarkably healing and helpful. I think the patronization of the Western world towards children is also a huge mistake in terms of healing, because children come into the world completely spiritually whole, completely wholly developed, with huge capacities, with a huge capacity to love and to attach and to help. So you have these children that are so fully 100% developed as babies. I mean, just even before they got here, they were whole. So they're completely whole, and they are these amazing sponges. They can sponge up the tragedy around them and absorb that tragedy. And that's the one thing they do well, is they hold the agony while the family moves forward. And I think that's often not honored and perceived as an incredibly powerful, precious, amazing gift that our kids come in with, a gift to be able to help carry the family through. We all have jobs to do, and children start right off the bat. They'll pick up the trouble, so that the troubled aren't as troubled, and that they can therefore function better than they would if the child did not pick up the trouble. And then, unfortunately, without Indigenous psychotherapy, the person, just naturally sucks up all the trouble around them, but doesn't have a way of placing it down, because it kind of gets stuck in them, because there aren't ceremonies, and there aren't. I consider every session a ceremony in Aboriginal psychotherapy. That is a ceremony. We are working on downloading that which you absorbed in order to help the family through. So it's not seen as, oh, poor me, my mother was depressed and I'm holding her depression. And why is, I'm holding the agony, the lateral emotions of the adults around me. It's more perceived as, good job, you did well there. You kept everybody alive there, kiddo. not bad. And more something to honor and respect, and to not patronize these children that have had to do that. I've had to carry the load of my dysfunctioning parents for a long time, and that becomes my wisdom, not my trouble. But however, the patronizing and the reductionism in Western psychotherapy, where it doesn't look at the whole individual and everything connected to that individual, meaning, it's not just my neurobiology, it's the neurobiology of my father, my mother, the very land around me, and the animals. I'd love to talk about transformation a little bit, because transformation is another, amazing part of survival. Here's another interesting story. So this beautiful gentleman came into a session the other day And he said, and this is a person who is, deeply tortured, and the decision, his father had presented the decision to him. What will it be? Will it be pliers, or will it be the extension cord? So he was saying to the boy, you have the choice of being, tortured by this or that. And so the man that was there presenting before me was saying, I can't make decisions. I've never been able to make decisions because my father put these horrible, torturous decisions before me, and I was never able to decide. And so, I asked him just to really go inside there from an Aboriginal perspective, and for him to recognize there really wasn't a decision there. Number one, his father had not given him a decision. It's not something he might have said those words, but in fact, his father was going to do whatever his father was going to do. It was just something that was going to happen, regardless of, if he had said, I'll take the pliers, the father might have given him the extension cord. There really wasn't any decision making there, but that he did make a profound decision, this boy. And so I asked him to check inside, and what did he decide? What had he actually decided to do there in his body when his father was presenting this horrible decision? And when he checked in, he wasn't sure what I was talking about. He said, well, what did you do with your body? What did you decide to do with your body right there when your father was presenting these decisions? And he said, well, I curled up. I said, okay, you curled up like a what? What did you become there? What did you decide to change yourself into while your father was presenting these horrific decisions? And, checking in further, he became a mouse. He became a mole. And it was like, wow, he transformed himself from a little boy into a mole, into a mouse. And, what does a mouse do when a vicious cat is in the room? Well, a mouse turns in, plays dead. So the boy decided to play dead. The boy transformed into a mouse and turned himself, paralyzed himself. This is a beautiful story. What do you get out of paralyzing yourself? Well, you get to make yourself very, very tiny, and it has a huge impact on the cat. The cat, just knocks you around a little bit, but eventually tires of you because you're not reacting, you're not doing anything, you're just playing dead, and it eventually just goes away. Right? So he was really, his relationship with his father there was a huge relationship there between the cat and the mouse, and this is a powerful, powerful thing for the man to know, because if he recognizes that he wasn't involved in the relationship and did find a way to help himself and to help the cat, so to calm the cat down and to help the cat not kill him, because that wouldn't have been good for the cat, and that wouldn't have been good for the mouse. That would have had huge impact on the family, and in order to keep the family going, the boy transformed into the mouse. So a whole different way of looking at attachment in Aboriginal psychotherapy, a whole different understanding that it's not about on, off, yes, no, right, wrong, bad, good. It's about relationship, and it's about, all the tools available and the ways in which this trauma story could be perceived. He went away feeling really good about himself that day when he discovered that, that he was an amazing decision maker. And maybe it wasn't the Western's concept of what a decision should look like. It was more, it was a story of transformation, a story of survival, and the enormous honor of being able to help carry that family forward, which is what he did as a boy. These survival stories are very, very powerful. And when coming out of genocidal policies that destroyed so much. We just don't have the luxury of a Western model and it's not helpful because it's sort of missing out on the strengths and the and the abilities of people to survive all odds. I love Bill Bear when he talks about our Neanderthal cousins who didn't make it. We barely made it, and we're making it, and we will make it much better if we can bring out our knowing, bring out our knowing about interrelatedness, interconnection, about our attachment orders, and to work from a body-centered place, and to work with the whole of it in a holistic way, and not reduce it down to I, me, mine, as if a felt sense within your body had something to do only with you. Well, it doesn't have only with you to do. It's to do with all of us. And I think that's another thing that's really available to trauma survivors is the connection between one another. I was speaking with one woman. I'm so honored. I've for 30 years have sat with trauma stories and the most remarkable people in this country and other countries. Their survival stories have touched me and taught me to believe in our culture and to believe in our ways. But this woman had a horrible experience that she had been taken to the schools at age 3. But by 6 she was forced to watch the murder of one of the things that sometimes happened in the schools. There were a lot of dogs, and some of the children were brought down to a room, and one of the children was the perpetrator had the dog attack and kill one of the children. And these are not unusual stories, unfortunately. These are stories. These are stories of residential schools, and they're brutal. But what happened? This woman, was terrified of dogs, but she connected with another person, through the years, who heard her story and said, "Yeah, that's what happened, and that happened to me too," and that. The knowing, the connectedness of survivors and sharing their stories and hearing from one another, and knowing that that their stories are not unique, they're not alone. Somehow that collective connectedness is really restoring. So the horror that this child, that what she had observed, and the horror that had held in her body was a shared horror, and she began to realize that the level of the horror that she was experiencing in her body was a collective horror. There were many children who witnessed children die by dog, and so. Recognizing and understanding that felt sense was a collective horror, she was able to finally release it into nature, into her own landscape. She did her own ceremony in her own land to release this collective knowing about the dogs. And I think that a lot of our emotions for trauma survivors, a lot of our felt senses that we hold on to for a reason, and not just it's not just to torture ourselves. Sometimes we hold it in order to make social change or justice. I can think about this. I was branded on my legs, and my legs would the scars of the branding would burn so severely, the felt sense of the memory of that. I'm not the only child that was ever branded in the world. There's, I'm sure, a lot of us, and so I'm sure that's a torture that's a common torture. Unfortunately, almost all the tortures that I come across with people in the world are fairly common tortures. But when I didn't need it to burn anymore, usually this thing would burn, but usually it would burn for a reason. It's your experiences and your memories are actually your wisdom and your knowledge. I'm a knowledge keeper. This is my knowledge keeping knowing about branding. And so, when I didn't need to tell the story of branding anymore, that children get branded in the world, and blah, 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 blah. And even now, as I'm sitting here talking with you, the sensation of the burning on my scars are, it's quite minimal. It's just a little tingling right now. And actually, I don't even mind it. Because that's, it's there so that I can tell. It's there so that it's a conversation. These things that come through your body are conversations with the world. Hey, world, stop branding your children. It's sort of it's the way of the body talking, and it's a wisdom, and it's a knowledge, and it's also an action. Especially now with residential school survivors telling their stories in Truth and Reconciliation, a lot of their the trauma coming up and through their bodies has a lot to do with justice, and so and the felt sense that they have is a collective felt sense. Again, I'm going to say that again. It's not all you. The sensations in my legs are coming through my legs, but they're everybody who was branded's story. It's not just my story, and that helps because I'm not alone. It helps tremendously. But right now, as people are telling their stories, the sensations coming up through their bodies are quite tremendous, right? And if they're looking at that from a Western model, it really does mean they're all up, and it's just simply not true. It's the way of the body saying, this is what it was, this is what happened, this is how it looked. And least we forget the emotional story, the energy story that's coming forward. It's not necessarily coming forward because it needs something so much personally, but what it needs is the world to change. What it needs is, the world to get this knowledge so that it can make better political decisions that would be helpful to children. So, Aboriginal psychotherapy is very holistic. It's justice-centered, it's land-based, it's all my relations, meaning that it's transformative to all species, all plant life, we're all one. But it's also extremely grounded. It's really about earth and now. It's really about land. It's really about justice and about it's the information in our bodies from the genocidal experiences and the torturous experiences that drive our passion, that drive our warriors, that drive the world to a better place. So it's, again, the holisticness of it is far-reaching. The reason I like focusing-oriented therapy to connect that to Aboriginal psychotherapy is because it is a body-centered psychotherapy, and many of our conversations with our ancestors, with our relations, whatever, those conversations come through the body. The conversation of white knuckles between himself and the hanging boy that came up through his body. And so focusing-oriented therapy is a good adjunct to Aboriginal psychotherapy, but Aboriginal psychotherapy is the foundation. The All My Relations, land-based Aboriginal psychotherapy is the foundation by which you can introduce some focusing techniques that help you move around flashbacks and complex trauma in a body-centered way. So